Hi all. Hi all. Today we are going to see about childhood development. In that we are going to see about prenatal developmental stages. Okay, prenatal developmental stages. There are three main stages in prenatal developmental stages. First is germinal stage, embryonic stage, fetal stage. In germinal stage, it starts from the fertilization to 2 weeks. During the germinal stage, from fertilization to about 2 weeks, a gestation age, the zygote divides, become more complex and it's implanted in the wall of the uterus. During this fertilization stage, the sperm and the egg will divide into zygote and it will fit in the wall of the uterus. Next is embryonic stage. This is the second stage where it starts from 2 to 8 weeks. During the embryonic stage, the second stage of gestation, from about 2 to 8 weeks, the organs and major body system like respiratory system, like lungs, digestive system and nervous system develop rapidly. During this 2 to 8 weeks, the baby's respiratory system like lungs, heart, everything will start developing rapidly. This is a critical period when the embryo is most vulnerable to destructive influences in prenatal environment. The most severely defective embryos usually do not survive beyond the first trimester. The first trimester is nothing but till three months, okay, or the third month of pregnancy. A spontaneous abortion, commonly called a miscarriage. During this period, there are many chances to get a miscarriage because of some reasons. Maybe it can be because of some developmental issues, or it can be because of any environmental causes. Okay, next is fetal stage. Fetal stage is 8 weeks to birth. The appearance of the first bone cell at about 8 weeks signals the beginning of the real fetal stage. The final stage of gestation. During the period, the fetus grows rapidly up to about 20 minutes in previous length, and the organs and the body system becomes more complex right up to birth. Final details such as fingernails, toenails, heads continue to develop. Okay, during this period, every organs will start to develop quickly, and in this period the growth will be 20 times rapid than the other stages. Okay, for example, the hairs, nails, skins, everything will start begin during this time and it will be rapid. Okay, next is prenatal risks. Prenatal risk is nothing but if a woman is pregnant, he or she will have some risk. It can be whether mentally or physically, or it can be anything. Okay, prenatal risk refers to a factor that can harm the developing baby fetus before birth. Okay, it will affect both the mother and the child. These risks can affect the baby's physical health, brain development, and causes birth defects, miscarriage, and low birth weight. Low birth weight is nothing but premature birth. Okay, there are many reasons why this prenatal risk is happening. First is genetic risk. For example, if a mother or a father, or if a grandmother or grandparents is having some genetic issues like any blindness, or anything handicap or anything, it will affect. Sometimes it will affect the baby too. Next is environmental risks like sounds from the environment, or some other things. Okay, maternal health risk is nothing but it is very important for the baby to grow inside the fetus, because if the mother is happy, then the child will also be happy inside the womb. If the mother is not happy, or if she is having any other mental issues or physical issues, it will affect the child also. Okay, next is lifestyle and emotional stress. Like if the mother is having any high stress or domestic violence, or poor mental health during pregnancy, as I said before, it can also affect the fetus. Okay, age related risks like teen pregnancies, like 18, 19. If a woman is getting pregnant in 18, it will affect the baby in some other ways. Okay, next is or late pregnancy after 35. Okay, it will lead to some miscarriage or some other issues. Okay, that is like premature birth, miscarriage, chromosomal abnormalities. Okay, Next is how we can um, how we can like protect these problems. Okay, first is early detection. If you are going if a woman is getting pregnant or got pregnant, he or she should she should consult the doctor monthly. She should get the regular checkup from the doctor to know how the baby is growing inside, and how is there any issues for the baby or for the fetus. Okay, next is health education. They should get health education, like how they should be in the pregnancy period. Next is improved outcome. What are the outcomes will they get if they followed all these? Okay, like getting a health checkup or getting health educations, all. Okay, all these matters for a pregnant woman. What are the common birth problems? First is neural tube infection, like spina bifida, where the spine is not closed properly. This is a one problem where this kind spine is not closed properly. Down syndrome is nothing but the baby will have only 21 chromosomes. Okay, next is congenital heart problem. This is nothing but some issues in the heart, structure of the heart. Okay. Next is interuterine growth restriction. The baby grows smaller, slower than normal inside the womb. The baby won't be growing normally, and it won't have the proper development. For example, if a baby should develop for example, if a baby should be developed respiratory or digestive system should be developed within 3 months. If the baby is not getting developed, then that baby is having some issues. Okay, thank you. Hi all. Today we are going to see about early newborn traits. Okay, what are the newborn traits? There will be there in the babyhood. Okay. Yes, early newborn traits. The first newborn traits is reflexes, involuntary movement that are present at birth. Okay, that is grasping and sucking. Once the baby is birth, it just only knows that grasping and sucking. Okay, next is sleep pattern. A newborn sleep 16 to 18 hours a day in a short period. Okay, for the first 3 months, the child will only sleep. They will sleep at least for 16 to 18 hours in a day. Okay. So most of the time during the 1 to 4th month, the child will mostly in sleepy. Okay, 1 to 3 months, the child will mostly sleeping continuously. Okay, not continuously. Maximum 16 to 18 hours, the baby will be in the sleep, because sleep is essential for their development, especially for brain development. Okay. Next is cry as communication. Crying as communication. Crying is the main way to express needs. Okay. The main need of the baby is hunger, right? The baby will cry only if the baby is feeling hunger, or if it is having any discomfort in the body. Okay. This is the two main reason why the babies are crying. Okay. During the first 3 to 4 months. Next is poor vision. The baby can only see about 18 to 12 inches away, prefers faces and black and white contrast. During the babyhood, the baby will be able to see only 8 to 12 inches away. They won't see beyond that. Okay, and they will see the faces in black and white only, that too not clearly. It will be little blur. Okay. Next is strong sense of smell and hearing. Can't can recognize the mother's scent and voice very early. The child will be able to recognize the mother's smell as well as the mother's voice early, because it is used to that voice uh, in the starting itself. So it will be able to recognize it as early as possible. Okay. Needs close physical contact. Touch and skin to skin contact help the baby to regulate the body temperature and bonding. Why the baby is always Why the baby is always uh, sorry, lying nearby the mother is the only reason is for that warmness, okay, that warmth and that bonding with the mother, okay. This is the only reason they always want their mother near them, okay. Okay, next is significant changes. The first one is brain growth and sensory development. Okay, during this babyhood stage, there will be a rapid brain development and enhances, and the brain development enhances the sensory awareness. The sensory awareness is nothing but smell, touch, here, okay. All these will be rapidly developed during this stage, okay. Example, a baby starts to follow objects with their eyes and respond to, if we are showing some toys to that baby will move the eyes wherever the toys is going, or whatever the things we are showing to the baby will automatically rotate their eyes okay, following the toys, okay. Next is respond to sounds. If you are asking something, or if you are talking something, it will respond through the sounds, okay. Next is motor developmental stage. Gradual control over head and limbs. During this period, the baby will be able to balance their head. Okay. Example, baby begins lifting head during tummy time. If the baby is feeling hungry, it will show some of the signs, okay. Next is formation of social bond. Begin to smile in response to human face, okay. Social smile, 6 to 8 weeks. The social smile will start in the 1 2 months, okay, maximum from 2 months, okay. So the baby will begin to laugh to the face which is familiar to that baby, like the caretaker or the mother or the father or the sibling, whomever is talking or talking with that baby. The baby will automatically start see and start smiling, okay. Next is recognition of caregivers. Yes, during this period, they will start recognizing their caretaker's voice or smell, and they will start respond to our questions. Okay, like giving ooh sounds. Okay. Next is early communication. The early communication is like giving a cooing sounds, like simple sound. They will do ooh. Okay, all these sounds will be they will be start giving during this time. Next is Piaget's cognitive developmental stages. In this, both of them are there, hazards as well as happiness. Okay. First is sensory motor stage. This age ranges from 0 to 2 years. Okay. Happiness. What are the positive outcomes will be there in this year? Learning things by touching, looking, moving. Okay. They will learn new things by touching the toys, feeling the toys. Okay. And moving the toys. Develops object permanence, forms strong attachment. During this time, they will be much closer to the other child. They will play with the other childs and they will enjoy that. Okay. Next, hazards is lack of sensory stimulation. Neglect leads to fear and insecurity. During this time, the baby will avoid strangers. They won't go to strangers. Okay, they will always be with the caretakers. Okay. Next is, for example, baby looks for a hidden toy under a cloth. If left alone, baby may become anxious around people. Okay. Next is pre-operational stage. This age ranges from 2 to 7. Okay. During this stage, rapid language growth, enjoys pretend play, being begins symbolic thinking. During this stage, their language development will be rapid. Okay. They will talk. Their speech will be automatically developing. Okay. Enjoys. They will be enjoying with playing the other childs and with their siblings. Okay. And they will start thinking that during this time the curiosity, creativity, hmm, all these will be started developing. Okay. Next is egocentrism. Can't see others view, confuses fantasies and reality. In this stage they don't know which is real and which is not real. Okay. Child uses a banana as a toy phone. Child thinks the moon follows them everywhere. Okay. All. Okay. Next is concrete operational stage. This age range from 7 to 11. During this stage, they will understand max logical reasoning rules. They will learn the rules, new rules, teamworks, and fairness. Gains confidence in abilities. During this period, they will be able to uh, uh, solve some problem, and a logical reasoning will be developed. Okay, they will be able to follow the rules and understand the rules during this time. Okay, they will be gain confidence during this time. Next, struggles with abstract thinking may become rigid or too rule bound. They will think, their creativity and the curiosity, they will think which is real and which is not real. They will be in a confused state. Okay, so they will able to understand the reversibility. Okay, understand that 5 plus 3 is equal to 8 and 3 plus 5 is equal to 8. So the both of the logical reasoning they will understand during this stage. Okay, next is formal operation. This is from plus 12 years. Okay, thinks deeply, 12 plus years, thinks deeply and critically, understand abstract topics like justice, future plan, goals. Okay, may overthink or worry, become idealistic or confused about identity. During this time, they will be start overthinking about small things, and they will be able to understand a simple topics, and they will start planning about their future, like what they are going to do in their future, which group they are going to do, and how much mark should they score. Okay, may overthink or worry, may become idealistic. They will be this is the stage where they will overthink very much. Okay, and they will become confused. Okay, things about what if there is no gravity. Okay, there are some sub stages of the sensory motor stage. Okay, the first sub stage is reflexive schemes. Okay, this age range from birth to 1 month. Uses of reflexes to explore environment. They will suck nipple or finger. Okay, this is the only thing they know after the birth. Okay, next is primary circular reactions, 1 to 4 months. Repeating pleasurable actions centered on the body, repeatedly sucking them, because that give them some pleasure for feeling sleepy or whatever. Okay, it will give some pleasure. Next is secondary circular reactions. That is 4 to 8 months, repeating actions to affect environment. Banging a toy to hear a sound. For example, if suddenly a tumbler, a glass fell down, the child will hear that sound. Okay, once the child hear the sound, the next time it will do the actions repeatedly to hear that sound. Okay, next is coordination of reaction, that is 8 to 12 months. Combining actions to solve problems, objective permanence begin. Okay, pulling a string to bring a toy closer. For example, they will be able to how to say, they will be able to solve some problems. Okay, like pulling a string to bring a toy closer. Okay, next is tertiary circular reaction, 12 to 18 months. Experimenting with new actions to see results. Dropping a spoon from different heights, like they will take an object and they will drop it in a different heights to hear that sounds. Okay, next is mental representation, that is 18 to 24 months, beginning of symbolic thinking and problem solving. Okay, they will be. Thank you.